Spicy or bland, salty or not so salty? Does it make a difference from a health standpoint? Recent studies claim excessive salt may be responsible for 10% more heart attacks and strokes in America, and that most Americans consume way too much salt in their diet. Our medical expert, Dr. David Winter, is joining us now to talk about salt and how it affects our health. Good morning, Dr. Winter. Now tell us all about salt.
Good morning.
And what...
Good to be with you.
Wonderful. Tell us about salt and what all it does to our bodies.
Well, salt tends to raise blood pressure, and higher blood pressure is harder on our bodies. I'm going to use my model to demonstrate. If you think of your body as a machine, the heart distributes nourishment and oxygen to the rest of your body. So higher blood pressure, more stress on the heart, also more abuse to the blood vessels as they dilate and constrict to absorb that pumping action. So the more pressure, the more salt, the more risk to your heart, the more risk to your blood vessels.
How much salt is too much, and how can we reduce the amount of salt that we're all taking in from our diets?
Yeah, the American Heart Association says we should have less than 2 grams of salt a day in total. Most Americans have more than twice that amount. Salt's in a lot of foods we eat. All processed foods tend to have salt in them. Soups have a lot of salt in them. Sauces, barbecue sauce, soy sauce, teriyaki sauce, even ketchup has a lot of salt in it. So salt is everywhere. And of course, it's also needs salt shaker. A lot of people use way too much of this. The salt is the problem here, Dia.
Well, what about salt substitutes? They're all over the place. You can get them in any grocery store, but are those better for us than salt itself?
You know, there were some studies that said that salt substitutes were better and had less heart disease if you use those. The problem is sodium chloride is regular salt. Potassium chloride is salt substitutes, and it doesn't taste quite the same. Some people just don't quite like the taste of it. Also, if you have any kind of kidney disease, too much potassium in the salt substitute is bad for you. So I think a better alternative is just to use less salt.
All right. Now, you know you're talking to folks. We're in Texas. We love to eat. So cutting back on salt definitely alters the taste of food. I can imagine that many of the things that we eat would taste pretty bland without just a little added salt there. So, I mean, what are some of the other alternatives? I know you say use less, but what's the advice?
No, you're right, Dia. And I've had patients with other medical diseases that had to have a real low salt diet, and they all tell me that food really did taste bland, wasn't very appetizing for a couple of months. Then their taste buds changed, and then things were fine. In fact, if they then ate high salt foods by accident, it didn't taste right. So you can actually lose that taste for high salt. And you can use other flavors, lemon, citrus fruits, garlic powder, not garlic salt now. That's a good substitute. Peppers, jalapenos, all those things can work. So the salt is the issue, and I would think now we have to realize that the leading cause of death in America still is heart attacks and strokes, and less salt can have less of those. I'm recommending less salt.
All right, Dr. Winter, with some important information for us on this Thursday. Thank you.
Thank you, Dia. Good to be with you.